Welcome back. This is the second half of the first set of information for your first test. So we kind of begin introducing abnormal psychology. So we're going to, the nice thing is you can stop and rewind this and watch it more than once, but instead of putting everything on the board and just having this big clutter, we're gonna walk you through everything here. And so we're going to go through some really important stuff today for abnormal psychology. So in 1547, your test question is going to say, what did King Henry VIII in 1547 do that affected psychology cases? And in 1547, King Henry VIII, he opened up what was called the St. Mary of Bethlehem Asylum. And what he did is kind of ironic because we're going to talk about King Henry VIII, and King Henry VIII actually suffered from some insanity himself, and we're going to talk about this. It's really interesting. He's one of our case studies, and but he actually took people who supposedly, we're going to use the word again, crazy. We use that word a lot in this class, but we got to define that as somebody that can't function in society. And so he took this humongous castle and he said, okay, we're going to have this St. Mary of Bethlehem, so it sounded pretty good, asylum, meaning to get you away and give you an asylum, give you a protection from society. Well, this really isn't what Hippocrates says. Hippocrates says we're not to isolate these people, we're trying to treat them as if it was a disease. But King Henry VIII took this big castle, and if somebody was behaving in a way that they thought didn't fit society, then they didn't have a choice. They automatically put them in there. So there were actually insane asylums around the world for a while, and it was kind of a bad deal because if you were back in the mobster days, back in the old days of Bonnie and Clyde, if they were corrupt, they might have a doctor that maybe was corrupt and owed them money or something. And then that doctor would say, I commit you to an insane asylum, and you went there. Well, it wasn't an asylum where they actually had a really nice life. This is where they would put straitjackets on them. This is the padded cells. This is put them away, give them so much sedative that they don't exist during the day. So it was really a bad, it was really not a humane system, the way to treat people. But we had these insane asylums. So it took us a long time to overcome King Henry VIII's formation of this St. Mary's of Bethlehem Asylum, because as he set that example, people followed that. So we don't have insane asylums anymore. We do have psychiatric hospitals where people go, but the idea behind a psychiatric hospital is that you'll be treated and then you'll be released, that you're not totally taken out of society. So there's two concepts of abnormality. Okay, there's two concepts. The first one is called statistical abnormality, as in the statistics. Okay, so in statistical abnormality, it means that a low percentage of the people have it. So when we say somebody is abnormal, well, what's abnormal? Well, it depends on what they do. If it's statistically abnormal, then a very low percentage of the people do it. How do you do? Fill in the blank. If you're at a very low percentage, like everybody does certain things, okay, like for example, I was working with a little kid the other day, and instead of writing things from top to bottom, like writing an 8 like this, he started at the bottom on everything. Like he wrote every letter upside down. So statistically, I don't know if there was anything wrong with him, but statistically, he was statistically abnormal in that he did it different than most of the population. So we don't know in somebody that is statistically abnormal if there's a true abnormality or if they just do it different than everybody else. And then the other type of concept of abnormality is psychogenic. So it's psychogenic. A psychogenic abnormality means it's a true psychological problem. Something with the neurological part of the brain or the body or the thinking. So a psychogenic abnormality is a true psychological problem. So we have to say, is it just statistically abnormal? Do they just do it different than everybody else? Or we have a true psychogenic abnormality, which is a psychological problem or handicap. Now, there's two approaches to abnormality. We got to say, okay, is it Is it biological? Is it something with the body? Is it something with the body? Is there something? Is there some type of neurotransmitter? Is there some type of muscle defect? Is there something with the spinal cord? Is it something that we can literally find a reason why our body doesn't do it properly? Okay, all right. Or is it psychological? Now, psychological means the thinking part of it. Now, let's say that we don't have enough serotonin, or we don't have enough norepinephrine, or we don't have enough acetylcholine in the brain. So that would be biological. Not enough neurotransmitter, that would be a biological problem, okay? But psychological means that's the mind. How do we think? Everything is good in our body, our neurotransmitters, our nerves, our brain, our spinal cord, all our muscles, everything is fine, but yet we see this type of behavior. That would be psychological. So biological, the body; psychological, the mind. That's the two approaches to abnormality. And you're getting the hang of this. That's what the question is going to say on your test. Name and define the two approaches to abnormality. Biological, meaning the body, and psychological, meaning the mind. Now, we have something called the DSM. Once again, the DSM. The DSM stands for the Diagnostic Statistical Manual of the American Psychological Association. So the DSM is our manual. So in this manual, okay, we have there's a lot of different things. I want to just briefly show you a page. I want to show you a page of a couple of pages here of the DSM, and if we could, I don't know if we could zoom in on this a little bit, but this goes through all of the different. This goes through all the different disorders. No, can't. Well, I tell you what I'll do. I will make a copy of the DSM and put it in your. I'll try to get a copy of this and put it on your deal. My expertise technology lady says this is set for people and not for print. So I will get. But the DSM goes through and it lists all of the psychological disorders and it puts them into different categories. So here's what we're going to do. We're going to learn the 5 axes, okay? The 5 axes for classification of a psychological disorder. And this is how the DSM is organized. So axis 1, okay, and it's Roman numeral 1, okay? So axis Roman numeral 1, capital I, okay, is a symptom disorder. So anything in a symptom disorder, we actually see the symptom, that's how we define it, okay? So axis 1 is a symptom disorder. Axis 2 is a personality disorder. So anything that affects your personality falls in an axis 2. Axis 3 is a general medical condition. Oh, so axis 3, we have a medical condition. Something's wrong with our body that doesn't allow us to do that. And axis 4 is a psychosocial disorder, okay? So it affects our social functioning with other people. It's a psychosocial problem. Axis number 5 is global assessment, meaning that there's several different reasons for the cause, okay? So once again, there's 5 axes tied in with this DSM. It'll say, your test will say, identify the 5 axes for classification of abnormal psychological disorders. Now, it'll be interesting, since we make these tests on the computer, it's interesting how some of them are answers that we just grade all the way through. Some of them are matching. Haven't decided how we're going to set this up yet, but you'll be responsible for knowing the 5 axes of classification for abnormal psychology. Axis 1, symptom disorders. Axis 2, personality disorders. Action is right, but axis 3, general medical conditions. Axis 4, psychosocial problems. And axis 5, global assessment. So, once again, you need to know those. Now, what we're going to do now, the last part of this, for the last part of your test, we're going to talk about some developmental disorders. These are things that as you, from the minute that you're born and you begin to develop your brain activity, your body activity, your psychological activity, these are things that happen in development. So, these are things that are not actually really reversible. We just have to deal with it. The first one we hear a lot about is autism. Now, autism, once again, is a developmental disorder, okay? And it's characterized, okay? So we define autism, all right? Once again, so this is kind of like a symptom disorder in axis 1. It's a developmental disorder because we know what it does. We don't know exactly what causes it. We don't, there's a lot of study on autism. It's interesting because we're seeing more autism than we ever have before. So we try to say, okay, is it genetic or is it environmental? What's causing these things? And once again, we know from Psychology 101 that it's both. So in this case, okay, autism is characterized by impairment, significant impairment in social interactions. Okay, when we say significant impairment, which means we have difficulty. Even though we try to practice, we try to do it, we have impairment, we have difficulty in social interactions, communications, and we also have restricted patterns of behavior. Causes us to not be able to do a lot of the different behaviors. Autism is also a restricted pattern of lack of interest, and it's also a lack of activity. So autism is, once again, a developmental disorder, and is characterized by significant impairment in social interactions, communication, behavior, interest, and activity. Now, we're going to move on to Rett's, okay, and autism is A-U-T-I-S-M, okay, we say a child is autistic, meaning they have autism. Now, Rett's, capital R-E-T-T-S, this is a neurological development where we have impaired motor skills. So, in this, there's a good chance that this could be a biological deal because, well, it is biological, but it's a neurological disorder where we have lack of motor skills. The first thing we notice in somebody with Rett's is their handwriting, because they cannot take and just literally have good motor skills. Now, that doesn't mean that everybody that has bad handwriting has Rett's, or half of us would qualify. But once again, it's a lack of motor skills. So we also have a possible mental retardation, means that the brain cannot process things. So Rett's is neurological, impaired motor skills. It's typically known right away by really totally illegible handwriting, but it goes further into that, and it goes into mental delays. Then we have Asperger's. Now, Asperger's is a type of autism, okay? Asperger's is a type of autism, but Asperger's is a high-functioning end of autism. So it means that somebody that has Asperger's has a type of autism and developmental delay, but even though they have social interaction, they're still able to function, okay? And their communication, they have trouble with communication, but they can still function. They have lack of interest, but they can still function. And they have a lack of activity, but they can still function. So Asperger's is a type of autism with high functioning. And then we have Tourette's, T-O-U-R-E-T-T-S. Now, that's a developmental disorder that we call a tic disorder. And a tic is an involuntary. Now, this is not like a tick, like a little bug that sucks the blood there. This is a TIC, and a tic disorder is an involuntary repeating movement or vocalization. So in Tourette's, we pick up some type of signal to the brain that does something involuntary that we don't even realize it does. Could be a head movement. The tic could be just saying something, like every so often it could be and the person doesn't realize they're saying it, but it just happens. So that's called a tic disorder, TIC. That's Tourette's. So that's we're just going to touch on those four. We just want to talk about those. Those are 4 examples of developmental disorders. Those happen. We can't reverse those. We have to come back. So we'll talk more about those later in abnormal psychology. We're going to cover a large section of them. Today we talked about some developmental disorders. So that's everything on your test. Everything from what is abnormal psychology to these different types of psychological problems: autism, Rett's, Asperger's, Tourette's. What's a DSM? The 5-axis. Defining the 2 approaches for abnormality. 2 concepts of abnormality, King Henry VIII, the difference between intelligence and wisdom, the Hippocratic Oath and Hippocrates, and psychiatry, psychopathology, clinical psychology, difference between aberrant and deviant, and what is abnormal psychology. And you might want to rewind that once or twice, but that's everything that's on your test. And good luck. I can hardly wait to see your test. See you next chapter.